Okay, Lisa, when you're ready.
Thanks, everyone. Hi, I'm Lisa Catledge. I work at Catholic Charities at here in Ann Arbor. I am with the Senior Services Department. So what we're going to do in a very short period of time is kind of do an overview of all the services that we have here. Winona is also going to be sharing the presentation with me. So I'll give some of the information and then she'll give some information as well. We also have two other people on with us who are part of Senior Services. I believe Kevin and Rachel are also online, so feel free to jump in if we leave anything out. So just an introduction, we are an older adult program serving older adults. We've been doing that for, I think, 65 years. One question two questions that come up about Catholic Charities is, did you guys used to be Catholic Social Services? Are you guys, involved in that? And I'm like, yes, we changed our name, so we're Catholic Charities now. But have all the same services. And also, do you have to be Catholic to receive services? So, no, you do not. You do not have to be Catholic. So let me get through our mission statement. So our mission statement is to share the love and presence of Christ in our community through acts of compassion and mercy in a manner that respects the inherent dignity of every person. Our vision is changing lives through compassionate service, and core values are solidarity, empowerment, and sustainability. This is our services kind of broken down into three silos. So we have under the home services side, we have home safety and maintenance services, seasonal outdoor chore assistance, and home safe senior initiative. Under resource navigation services, we have website and printed directory, information on referrals, resource advocacy, person-centered options counseling, which I believe Ajoys is going to get more into detail about that when they come on. Community education, and which includes my program, Seniors for Healthy Choices. And there's one program listed here at the bottom, Retired Senior Volunteer Program, otherwise known as RSVP. We've had to retire that program, so we are no longer offering that. As you guys know, probably in your agencies, you've had to deal with some budget cuts, and so unfortunately had to retire that program. Caregiver services is the third pillar, which includes volunteer caregiver respite and grandparents raising grandchildren. So the home maintenance program is probably our most popular program, probably the most well-known program. It offers a variety of basic maintenance services to help older adults maintain their independence and keep them safe in their homes. Eligibility and cost. Now, instead of going over all this throughout the presentation, I'm just going to go ahead and say that this applies to almost all of our programs. You must be 60 and above and live in Washtenaw County. There's no cost to participate. Cost share contributions and donations are accepted, and no one is turned away for lack of funds. So these are the services that are included in home maintenance and minor repairs. We've got basic household repairs, routine maintenance, minor plumbing, home safety installation, smoke alarms, carbon monoxide detectors, battery and light bulb changes, grab bars, shower chairs, raised toilet seats. Brian is the contact person on this, and his information is in the lower left corner. Also assist with lawn mowing, gutter cleaning, leaf raking. Sometimes there's a wait list on these services, so it's a good idea to check with Brian. Things that we can't do is electrical and plumbing work inside the walls, accessibility ramps, stair climbing, assistive devices, change of residence activities, moving and rearranging furniture, decluttering, removing yard waste, or tasks that increase the aesthetic or resale value of the home. So those are some things that we can't do. The other thing is our home safe senior initiative, HSSI. So this is a program that can offer a little bit additional help to seniors in their home. It's supported by ARPA funding and it expands upon the existing home safety and maintenance programming. And it enables us to address needs beyond the scope of our current services. It also offers direct financial support to help older adults address mild to moderate safety concerns that require the expertise of a skilled professional. The funding is available on a bi-monthly basis. So every other month, funding is released for the HSSI program. September and November are the next dates to do that. And the highest priority is given to those that have urgent needs, such as no running water. Okay, and now I'm going to turn it over to Winona to talk about our resource advocacy division.
Hi, I'm Winona Phillips. I'm a case manager with Senior Services, and I'm part of the resource advocacy team. So I'm really excited to tell you about our services. This is probably one of the most popular pieces of resource advocacy. We have the resource directory. And oh, the slide just disappeared, I think.
And I did that.
Sorry about that, everybody.
Let me try this again. Sorry. Okay.
Okay. So we have a senior resource directory that comes out each year. It's a comprehensive guide updated every year to reflect the latest information. There are 33 categories of essential resources. It's free, there's no cost, and we send this out to local nonprofits, senior living facilities, really anywhere that older adults would go, and they're able to access this directory to gain access to essential services. In Washtenaw County, we have currently distributed nearly 1,000 directories to local businesses and service providers. And if you're interested in getting a resource directory, you can contact Rachel. Her contact information is in the left corner. And then there is also the Senior Resource Correct website. So we have an online senior resource directory with over 500 countywide resources. We have resources for both Washtenaw and Livingston County. You can also take a quiz that asks you questions to determine what resources best meet your current needs. There is a crisis guide for Washtenaw County, and there are weekly blog posts. We do blog posts about caregiver services, about healthy aging. There's a blog post recently about Seniors for Healthy Choices, which is another presentation that Lisa and I will be doing. So she'll be talking more about that during the presentation. And again, if you have questions about Senior Resource Connect, you can contact Rachel. Her phone number and email is in the bottom left corner. So then there's resource advocacy. So resource advocates, we help with referrals to other agencies to meet the needs of older adults. We help with emergency funding, assistance with rent, utility bills. We can do referrals to other agencies as well to make sure that all needs are met in regards to emergency funding. We can help with filling out complicated forms like Medicare, assistance to applying to programs through DHS, and then also making sure older adults are referred to community resources to make sure their basic needs are met. And then the newest program is case management. So I'm the case manager with Senior Services. To be eligible for that program, adults must be ages 16 up. There's no cost to participate. I help with care coordination, navigating resources that are more extensive, like calling the provider to make sure that they've connected with the older adult, weekly check-ins to see how things are going, and checking on the service plan to see how they're doing with meeting their goals, and then also to address social isolation, creating engagement opportunities and connecting older adults to senior centers and other engagement opportunities in Washington County. And so as we've been talking about, the case management program connects older adults in Washington County to essential resources, ensuring access with dignity without stigma. And we work with community partners to promote self-advocacy and improve the well-being of older adults and strengthen their social connections. And so my contact information is right at the bottom if you have any clients or anyone who you think would benefit from case management. So this is a new program, My Options. The goal is to increase understanding, awareness, and to access community services as well as long-term care options. And Ageways will be talking more about this at their upcoming presentation today.
Thanks, Winona. I'll take the next part of the presentation. This is about community education. So we're also dedicated to empowering individuals with knowledge and resources to enhance their lives and communities. And so to do this, we offer additional presentations to the community in a variety of topics, which include senior services at CCWC, cybersecurity, and staying safe online, and 5 simple ways we can all do, 5 simple things we can all do to prevent elder abuse. And there is no cost to schedule or to attend a presentation. And Rachel's information is there in the bottom left-hand corner. And here are a couple of flyers for those different presentations. You may see these posted in various places. It's also pretty easy to drop in different agencies and dates and times and places. So you decide this is what you would like us to come and do for you. This is what the flyer will look like. Okay, and this is also another piece of our community education. It's the main thing that I do here at Catholic Charities is called Seniors for Healthy Choices. So it's a 6-week wellness and prevention program for older adults, teaching them to celebrate healthy aging, make healthy lifestyle choices, and avoid using substances. Like I said, it's a 6-week program, 2 hours, 1 day a week for 6 weeks. And some of the topics that we cover are understanding changes that come with aging, addressing feelings about aging, medication misuse among older adults, how to better manage medications, common medication side effects, and substance abuse and addiction in older adults. We also have tips for leading a healthy lifestyle. Presentations, we usually have refreshments and giveaways, and each lesson builds on the one before. And it's been a really great opportunity for seniors to get together and get some connection with other seniors, because y'all know how isolated our seniors can be in the community. So we're really enjoying doing this presentation. The next presentation that we have is going to be at St. Francis. Starts Wednesday, September 17th, and then the second presentation we have is at Chelsea Senior Center. That one starts on Wednesdays, beginning October 19th, I believe. I'm sorry, October 10th. And this is what the flyer looks like. You've probably seen me sending this to you through Barrier Busters. This is just our general flyer, but okay. And something else that we distribute with a presentation for Seniors for Healthy Choices is the medication toolkit. This complements what we do in our training, contains information about polypharmacy, common medication interactions, questions to ask your doctor, and how to safely dispose of the medication. It includes a medication diary, information on the common medication side effects, information and resources for safely taking medication, and practical tools for medication management, including a medicine bottle opener. And you can contact me for more information about this. I'll be happy to provide any seniors that you're working with a free medication toolkit. Just get in touch with me and let me know what you need. And now I'm going to hand it back over to Winona to talk about volunteer caregiver respite and the grandparents raising grandchildren.
Okay, so our volunteer caregiver respite program, we match trained volunteers to provide companion care to older adults. So it's specifically non-medical respite care, and this gives caregivers a much needed break. So to be eligible for the program, an older adult must be 60 or up, live in Washington County, and all volunteers must pass a background check to volunteer as a respite caregiver. Volunteers visit with the older adult for 2 to 4 hours a week. There's no cost to participate, and if you know a client that would benefit from this service, they can contact Susan Reynolds. Her phone number and email is below. Also, through the Volunteer Caregiver Respite Program, we work with the Washtenaw Support Network for Caregivers, and so they offer respite care to caregivers and older adults, and they have outings for the caregiver once a month where free respite care is provided. So that is another aspect of the program, and there also is a support group for the caregivers. The other program is Grandparents Raising Grandchildren, and so this is for grandparents who are raising their grandchildren, which is also known as kinship care. It provides a weekly support group. There's also weekly newsletters, educational workshops and presentations, and resource navigation, so financial assistance, assistance with food or clothing. We partner with Big Family in Michigan, and so they provide free Christmas gifts for the grandchildren. They also offer school supplies, and for grandchildren who have aged out, meeting their age 18, they offer like a assistance with housewares for moving to their apartment, so pots and pans and a comforter and that type of thing. And yeah. Here is an example of the newsletter. So it talks about day camps. In the summer, they're available. A conference facilitated by Dr. Kathleen Bush. Talks about different topics relevant to caring for grandchildren, attachment and bonding, parenting skills. And then there's also the Kinship Care Resource Center through Michigan State University that has a wide resource directory, and also advocates are available to talk with grandparents and provide support. Does anybody have any questions?
Yeah, we kind of flew through that. So yes, please let us know if you've got questions. Also, Kevin and Rachel, I believe, are on the call, and if you guys feel like we left anything out, please please chime in.
I have a question specific to home safety and maintenance. Would this involve like light domestic cleaning or supportive domestic cleaning?
It does not.
Understood. And then next question, for the Home Safe Senior Initiative, when it comes to shower grab bar installations, would you be able to provide the shower grab bars, or would?
Yes.
Okay, thank you.
And Sheila.
My question was similar to Nathan's. So I know you do grab bars and stuff. Do you do rails outside? Like if they have like a 2-step to enter their homes to put, if they needed like a rail for the home? Is that something you all assist with?
I don't think so. Kevin, Rachel, or Winona, do you know if we do that?
Presently, we do not do that. Hi, everyone. This is Rachel with Catholic Charities. I would recommend St. Joseph Helpers for something like that. We have been working with them to find ways to partner and to offer more home repair, home safety things in the community.
And you said it's St. Joseph Helpers?
Correct.
Okay. And my other question, the services that you all offer, is it just for those that live in Washtenaw County? What if they don't live in Washtenaw but work or attend church or something like that in the county? Does that?
Unfortunately, it's just for people who live in Washtenaw County at this time.
Okay.
Yeah.
Okay. Thank you.
Oh, and Winona, it looks like there's a question for case management. Is there a time frame they are provided for case management service, such as a 6-week limit?
So there's not a 6-week limit. How it works is like once we've established a service plan, once all the goals are met and the client's connected with community resources and feels well supported, then we can work together to determine if they still need the case management services. So really it's ongoing until all the needs are met and any barriers to care have been addressed, if that makes sense.
Looks like another question. Do you provide transportation service? We do not. But we can also make referrals for these services too that we do not provide. Some of these are in our resource directory, the printed version, or online. You can look these up to find other places. And language accessible service. We do have like a language line that we can use if there are people that we need to that speak other languages. And I believe this is for all of our services. We can get someone on the phone as an interpreter to make things easy.
Any other questions?
Okay, thank you. Your contact information was all over this presentation. I will take this presentation and put it on the Barrier Busters presentation tab on the website. And so for those that missed this meeting, they can have an opportunity, or anybody who wants to go back and see it again. And the slides will be there too. So if anyone wants to access the slides, we'll have them available.
Thank you.
Thank you.
Thank you.
Right, next in our lineup is Ageways. We have Sherry Smith. Are you ready? And we can go ahead and share your screen. Sherry, I know you were here earlier. Are you still out there?
She's muted.
Oh, is that what it is? Okay, Sherry. Check your volume. Check your
I
mute.
just realized I'm muted. Yes, thank
Okay,
you.
good.
Because I was talking to everybody and apparently I was talking to myself. So let me pull my slides up and okay, can everyone see my slides?
Yes.
And I'll start it as a slideshow. Show from the beginning. And I will, a quick kind of apology. I'm not going to talk about the My Options counseling program, but I will mention a little bit about it just because you might be expecting it now. I'm going to talk about some of the changes that happened for those of you who are familiar with the MAP program. We're now called the My Options Medicare Assistance Program, or there's My Options counseling that is doing long-term care options counseling. And the phone number for that is the number that was always the MAP phone number, 800-803-7174. And if you call that number, it goes to a statewide call center who will do an intake and direct the call to someone who can do person-centered options counseling in one of our counties, or who can do the SHIP counseling, which is what I'm going to talk about today. If my slides will move. There we go. So I'm going to talk about how a SHIP counselor can help folks for Medicare. So there are SHIP programs in every county of the US and some territories. Michigan, as I mentioned, this was called the Medicare Assistance Program, or MAP. The phone number 803-7174, that's an 800 number, is found on the back of the Medicare and new booklets that are sent to all Medicare recipients each year. And that number is also going to be available for the person-centered options counseling for long-term care. We do have a local number now, which is 248-262-0545. And as we're busting down barriers, that's a good number to give people if they want Medicare counseling, because if they go through that number, they will come to our office directly, as opposed to calling the 800 number, where they will be at a statewide call center. So they'll have to talk to somebody before they'll get to a counselor. They may have to talk to a couple people before they get to a counselor. So I highly recommend using our local number, again, 248-262-0545, for anybody who's looking for Medicare counseling. So our mission is to empower, educate, and assist Medicare eligible individuals through objective outreach, counseling, and training. I will add that all our services are 100% free, and we are not part of any insurance companies. We are not licensed to sell any insurance products, although we can enroll people in plans. I added this just for your reference. It's just a few definitions, because people tend to get confused about what a premium, deductible, a copay, co-insurance are. So you can really just kind of read this for yourself, but it's a handy thing to have if you're working with people and they're confused about, well, I have some sort of a charge, I don't know what it is. You can refer them to this and explain what the differences are. So Medicare is health insurance for three groups of people. It's for people who are 65 and older, people who are under 65 with certain disabilities, and people at any stage with end-stage renal disease. It's administered for the Centers for Medicare and Medicaid Services, and you enroll through Medicare through the Social Security Administration. It's automatic for those people who are receiving Social Security. They get an initial enrollment package 3 months before they turn 65, or on the 25th month of their disability. And if they're not receiving benefits, they have to either go to the Social Security office or enroll online at ssa.gov. It's really much easier to enroll online if people have access to it. You don't need to actually be drawing Social Security. You just go to the site and you click the button that says Medicare and you follow the links. It's much easier than trying to make an appointment or waiting in line at Social Security. What people will get is they'll get a letter, a booklet, and a Medicare card. It's sent to people who go to SSA and sign up for Medicare. It's sent for people who are first eligible for the retirement benefits, and automatic for those who are with less than 3 months of coverage, usually people under 65 with certain disabilities. It generally arrives 2 weeks after you sign up for Medicare or Social Security. And that's always a good question to answer, because people say, when am I going to get my card? If people are in a hurry and they haven't received their number, particularly around this time of year for when it's open enrollment time, they can call us and we can sometimes find out what their Medicare number is, even if we can't get their card ahead of time, and help them to enroll in a plan. The Medicare card looks like this. Those of you who've been around for a while know it used to be a Social Security number. I want to note that the 11-digit Medicare number does not identify an individual in any way. There's nothing in it that, like the M that's in the 8th place, doesn't mean male, it doesn't mean man, it's just an M. They did this to avoid identity theft that used to happen. And if people want to have Medicare with Part A and Part B, which I'll talk more about in a minute, they keep the card. If they don't want Part B, and that would be for people who are continuing to work and have credible coverage through their insurance, they can sign the back of the card and then send it back. And then they will just have Part A, which is generally free for people. And they can sign up for Part B when they lose their work coverage. So there's 4 parts to Medicare. There's Part A, which is your hospital insurance. that is generally free for most people. There's Part B, which is medical insurance, which is currently $185 a month for people at, for lack of a better term, average income. You can pay less than that if you're at lower income, and you can pay more than that if your income as an individual exceeds $106,000 a year for an individual or 212 for a couple. And Medicare A and B are what we call original Medicare. There's also Part C, which is Medicare Advantage, which are HMOs and PPOs, and they roll your A, B, and your Part D, which is your drug coverage, into one plan. And I'll talk more about each of these in a second. When you're first eligible for Medicare, there's generally two paths you can go on. The first is original Medicare, where you get your hospital insurance, your medical insurance. You add a Part D prescription drug coverage, and you can also add something that's Medigap, and that helps pay the, or it's also called a supplement, and it helps pay your out-of-pocket costs that original Medicare doesn't cover. Original Medicare is what we call an 80-20 plan. So Medicare pays for 80% of the plan, and you have to pay out of pocket for 20%. So getting a Medigap plan will fill in a lot of those gaps. The other option, as I had mentioned, is a Medicare Advantage plan, or Part C, that rolls your hospital, your medical insurance, and your prescription drug coverage into one plan. Those plans also often include other services like vision, dental, and hearing. They may have a fitness benefit and such like that. It's important to understand what each plan covers and doesn't, because when you're first eligible for Medicare, the path you choose can dictate how much money you're going to spend and where you're going to be in Medicare for the rest of your life. You can change, but it's harder to change. With the Medigap plan, if you want to add a Medigap plan, you have a 6-month window after you add your Part B to sign up in what's called a guaranteed right of issue. And what that means is they can't underwrite you for any medical conditions that you might have. So it doesn't matter if you've had cancer or you've had a heart attack or a stroke or anything. When you're first eligible, they have to insure you at the lowest prevailing rate. If you miss that window and you decide 2 years down the road you want to add a Medigap plan, then you're subject to underwriting and the costs can be very high. So when you're first starting off in Medicare, it's really important to have an understanding of how you want to access your health care and what it might cost you. And that's something that our counselors are well equipped to do. So this slide just shows a little bit more about what each of the things cover. So Part A, in addition to your inpatient care, is your skilled nursing, your home health care, hospice care, and then there's a deductible. And Medigap will cover that deductible depending on the plan that you choose. Part B is your outpatient. It's your doctor's visit, your outpatient hospital services, clinical tests, durable medical equipment, preventive services. That has a $257 deductible, which everybody has to pay unless you're at low income. And it also has, as I mentioned before, $185 a month monthly premium. We don't know what it's going to go up to next year. I've heard rumor that it's going to go up by $42, but I don't know that for a fact. But I think people should plan on it going up fairly significantly for 2026. Please note that original Medicare, which again is your A and B, does not cover vision, dental, or hearing, except under special circumstances. It doesn't cover long-term custodial care, and it doesn't cover over-the-counter medications. Original Medicare A and B also doesn't cover prescription drugs, but people will add a D. The special circumstances are medical circumstances. So for example, if you need cataract surgery, original Medicare will cover it, but they won't cover you for a routine vision exam. So Part D is prescription drug coverage provided by private insurance companies. People have to choose a plan and join it. All plans have formularies, which is a list of covered drugs, and you pay for the drug plan monthly on a premium, and you may have copays and deductibles. One of the things that our counselors do is help people to choose a plan by looking at the medications that they take, the pharmacies that they like to shop at, and help find them a plan that has the lowest monthly premium and the lowest drug prices. We have seen differences literally of over $1,000 between a CVS and a Walgreens. So it's really important when people are choosing a plan to know where the lowest prices are for drugstores. They can go wherever they want, but you kind of want to know if it's going to cost you, you know, $75 for prescription versus $3 before you walk in the door. Medicare Advantage, as I mentioned, is Part C. Those are plans that are approved by Medicare. They're PPOs and HMOs run by private insurance companies. They're A, B, and D. They don't all include D, but most of them do. The plans that don't are generally reserved for veterans who might choose to get their medications at the VA. They're capitated plans, so Medicare pays a certain amount of money to the plan for each member's care. That's why patients have to sometimes jump through more hoops, like getting prior authorizations before they can go see a specialist or have a particular treatment done, because the plans are money conscious, and they want to make sure that, you know, they're finding a balance between their bottom line and patient care. But of course, if they deny care, you can always appeal it. Most plans include dental, vision, and hearing coverage. Some plans also include fitness benefits and an over-the-counter spending card. Those are really nice. They're like somewhere between like $25 and $75 a month that people can buy things like their ibuprofen or bandages, or often food with those over-the-counter spending cards. And you have to use the networks, the network of doctors or hospitals in the plan to find it to be the most cost-effective for you. Although a lot of plans have out-of-network options, sometimes they're more money, sometimes they're the same amount of money, but people aren't necessarily stuck in network if they have a Medicare Advantage plan. It used to be that you were pretty much stuck in a very small network, and now they're very large. For example, if you get a Blue Cross Medicare Advantage plan and you travel to Florida for the winter, you can probably use your plan in Florida, where you wouldn't have been able to do that in the past. With original Medicare, you can go to any doctor you want who takes Medicare anywhere in the country. If you want to change your plan, you have, well, for joining a plan, you have a 7-month initial enrollment period, which is 3 months before you turn 65, the month you turn 65, and 3 months after. After that, you have to wait for the general enrollment period, which is in January of every year, and you'll end up with a late enrollment penalty. There's also annual fall enrollment, which is coming up very soon, October 15th through December 7th. With coverage starting January 1st. That is the time when people can change their Part D plans or Medicare Advantage plans every year. It's really, really important for people to check their plan every year. Doctors change, medications change, pharmacies change, prices change, and if you don't check your plan every year, you may end up paying a lot more money than you would otherwise. So we encourage everybody to really look at the plan that they have and look at the options that are available. And you look at the options that are available by calling us at 248-262-0545 and making an appointment. We start booking appointments for annual enrollment on September 2nd. Appointments don't start until October 15th, but we start to book up pretty early. Additionally, if you have a Medicare Advantage plan, as of January 1st of each year, you have another period that you can change your plan, which is January 1 through March 31. So if you miss the annual fall open enrollment, there's a Medicare Advantage open enrollment plan, provided that on January 1 of 2026, you have a Medicare Advantage plan. You can change back to original Medicare or to a different Medicare Advantage plan. There's also special enrollment periods for people who are at lower incomes. If people have involuntary loss of credible coverage, perhaps they lose their job or they retire, if they move outside the planned service area, etc. If someone's looking to change their plan, please let us know, even if it's off season. We'll find out if they're eligible for a special enrollment period. We would hate for someone to not change their plan because they didn't realize they might be eligible. So ways to join or change is, again, to call us. You can call the plan directly. You can call 1-800-MEDICARE, or you can go online at medicare.gov. We encourage people to talk to us because we can help guide them through that process and answer any questions as they go along. Our services are 100% unbiased and they are free. So Medigap, as I mentioned, are policies that are sold by private companies. They fill in the gaps of what original Medicare doesn't cover. That could be deductibles, coinsurance, and copayments. If you have a Medicare Advantage plan, you cannot get a Medigap plan. And all plans have letters. Medicare has parts, Part A, B, C, and D. Medigap has letters, A through N. And costs are the major difference in those. And not all plans are offered to people with under 65 with disabilities. This chart, although it might be kind of hard for you to see, shows the different plans that are available and what they cover. So Plan F and C are really not available for people anymore. Plan G is what we would call kind of the Rolls Royce of Medigap plans right now. And it covers virtually everything except the Part B deductible, which is at $257, I think I said it was. And there's different prices for different plans. And one of the things we can do, we can't sign people up for these plans, but we can give them very good estimates of what the plan might cost them and give them good phone numbers to call so that they're not trying to figure out what number for Blue Cross, for example, do I have to call to get a Medigap plan. So this is something that we really urge people to consider if they're going with the original Medicare route, because otherwise, as I mentioned, they're going to have to pay 20% of all their medical costs, and that can be very pricey. Additionally, I want to remind everybody of the guaranteed right of issue, which is the 6 months from taking Part B, where you get these plans with no additional underwriting. And they tend to run, for somebody who's new to Medicare, it's going to cost them somewhere around $120, $150 a month for a Plan G. And of course, these prices go up every year. So how can we help? We can help people understand their Medicare plans. We can help people compare and enroll in their Advantage coverage or their prescription coverage. We can help identify fraud, abuse, and scams. We can help people enroll in low-income programs. Other things that we do is we can help people with appeals if they get denied coverage for some reason. We can help them write it. The appeals have to come from the individual, not from us, but we can help them write it. We can help them if they're dually enrolled with Medicare and Medicaid. We don't do any Medicaid work unless somebody is dually enrolled, because we're the Medicare plan. So if they've got Medicare and Medicaid, we can help them out. Otherwise, unfortunately, they have to rely on DHHS for help. We can also help people with limited incomes. There's a lot of different options for them. There's something called Extra Help, which helps pay for the premiums for prescription drug coverage. There's Medicaid. There's the Medicare Savings Program, which is the healthcare portion of Medicaid, not things like food stamps and things like that. That program, I want to add, is under attack in HR 1. That passed the quote, big, beautiful bill. So it's something we anticipate we're going to see a lot of people dropping off that plan. And that's going to make some kind of de facto cuts to Medicare because the Medicare Savings Program helped people pay for Medicare. And if they're no longer getting the Medicare Savings Program, they may not actually be able to pay for their Medicare, which is going to make them de facto lose their coverage. And we're kind of dreading how that's going to come along and searching for resources to be able to help people because we know it's going to happen. There's also pharmaceutical assistance programs, which are those if you can't afford your prescription, so-and-so may be able to help you. Those are often not available for people who have some sort of federal insurance, but sometimes they are, and we always apply. And there's prescription savings programs that are like the GoodRx and things like that that can help people out if they're at limited resources or just want to save money. I want to talk for a minute about Medicare Advantage and Part D sales reps, because people tend to get bothered by these a lot. And if you are dealing with anybody who has an issue, these are some of the rules to know. They cannot solicit door to door. They can't call people on the state or national do not call list. They can't enroll someone over the phone during a solicitation call. So if they happen to call and say, I'm calling from this insurance plan and I wanted to just know if you were interested in the plan. And if the person says yes, they have to set up another appointment to enroll them. They can't offer gifts or incentives over $15 or offer a meal. They can offer snacks, but can't offer a meal. They can't engage in activities that mislead or confuse people. It's a tricky one, but it is a law. And they can't conduct sales presentations or collect enrollment information at a health fair or an educational event. A lot of times we get calls from people who tend to get enrolled over like a solicitation call, or they were at somebody's table and they gave them their information and the next thing they know they're enrolled in a plan. So those things are illegal, and we can also help people change back to their original plan. Medicare, I know I want to be respectful of time, so I just want you to know that Medicare does offer a number of preventive services, and most preventive services are free, although people may end up paying for an office visit depending on which kind of insurance they have. They do get a free welcome to Medicare visit when they're first eligible, and they get a screening every year that's called a yearly wellness visit that includes basically the same things. And there's your yearly wellness visit information. And I know these slides will all be posted, so I don't want to spend a lot of time on them. And these next few slides just show what a lot of the wellness and preventive services are that Medicare covers, and how often they cover them, how much they cost. And so I'm just going to click through them quickly. I do want to note that all vaccines are free of charge. And again, people might pay for a doctor's visit. So if they're looking to save money, if they have Medicare, they can just go to a pharmacy and get their immunizations, and then they don't pay anything for it. I also want to mention a word about fraud and scams. It's a multi-billion-dollar industry, and seniors are the biggest targets. Scam could be being billed for a service people never received. If someone uses false information to mislead you into joining a program, calls to ask you to verify your Medicare number to get a plastic card. We always remind people, one, Medicare is not issuing plastic cards, but two, Medicare has your number, so you don't have to verify it for them. They can give you a number. You can say, yeah, that's my number. No, that's not mine, but never give out the number. One of the big scams that was just recently broken up was for catheters. Medicare was billed billions of dollars for urinary catheters. They were put on people's Medicare summary notices, but individuals weren't billed for them, only Medicare was. So we encourage people every year to look at their every month to look at their Medicare summary notices or explanation of benefits, which is if you have a Medicare Advantage plan, and see if there's something billed that you didn't receive. Because if Medicare pays for it, we're all paying for it, and those billions of dollars could have gone a long way to help keep costs down. We also want to remind your beneficiaries that if they get a call from Medicare or the Attorney General or the police department or the IRS, that they're not real. They're 99.9% of the time it's a scam. The callers can be very insistent and ask for immediate action. They can be really quite scary. People should not be afraid to just hang up the phone. Also with AI, there's a lot of scams out there where they can actually imitate somebody's voice and say like, they can think it's their granddaughter calling and needs money. And they're going to be asked to pay for it in gift cards. Remind your clients if they're ever asked to pay for something in gift cards, it is most likely a scam. And to always verify if something looks fishy, hang up and then call the original source. So if you get a call that sounds like your granddaughter and she needs help and wants you to pay for it in gift cards, tell her you'll call her right back, hang up and call her on her number. And also we remind people not to be embarrassed or afraid if they've been a victim of a scam. They're really tricky. Anybody can get scammed. And the Senior Medicare Patrol hotline is listed on here. If somebody does become a victim, this is the best number to call to report that scam. Ageways, as most of you know, has our information and assistance program that can help people get services, and it's the best way to get into any of our programs. And their 800 number is listed below. And we encourage people to call us or refer their clients to us if they want to speak to a counselor about a specific situation. Our services are confidential, free, and unbiased. We counsel over the phone, over Zoom or Teams, and in person. No questions too trivial. We often deal with very complicated issues as well. And open enrollment is almost here, and people should be marking their calendars to give us a call to set up an appointment so we can do a benefits review for them. The phone number again would be the 248-262-0545 number. They can call the 800 number, but it's a longer process to get to somebody. And these are just some additional resources that people might want to look at. And that's my contact information. And you can reach me through the direct line as well. If you email that address, and you want me, just say it's for Sherry, or just use smith@ageways.org. That's our mandatory funding statement. And that is a quick overview of my dog and pony show that usually takes me significantly more time to go through. So I'm going to stop sharing and try and find you on my screen, which
We also
sharing.
have
There
a
we
couple
go.
questions in the
Okay.
chat.
Sure.
Nathan, yeah, go ahead. Do you see them?
Here. I do. Do I share the slide with the contact information again? It's going to take me a minute to pull up my slides, so I will just put it in the chat. This is my direct contact. Or you can contact ship@ageways.org. And the phone number is 248-262-0545. Okay. There's one question that I don't see the other ones. Are there other questions in the chat?
Yes, we got one from John. If someone has VA healthcare and they turn 65, what coverage should they sign up for?
Is it TRICARE, John, or is it just going through the VA? If it's TRICARE, they're probably set. If it's VA, then we would want to talk to them about how they like to access their care. There's advantages to going to the VA, but there's disadvantages to going to the VA as well. If you don't sign up for a Medicare plan because you're getting everything at the VA and you happen to get sick where there's not a VA, then you're out of luck in terms of accessing your health care. You have to pay for it. So that would be something that we would want to talk with somebody about in terms of how they, how they live their life, how they access their care, and we can better advise them at that point. Other questions?
Amy, I see that you're requesting for the slide with the contact information again. Sherry posted, or she put in the chat, her email and the Ageways ship email. Is that good for you?
Yeah, thank
Okay.
you.
Okay. And then again, the slides will be on the website, Barry Buster website too.
Yeah, and feel free to reach out and please refer your clients to us because we very much want them during open enrollment, particularly because it's just so important.
Thank
Is
you.
there-
Thank you so much, Sherry. I did have a question quickly because I wanted to first thank you for your continued support and willingness to share these resources. Thank you also for identifying the ability to support individuals to identify scams. You were kind enough to put up an 866 number. If you could just put that up again, I had never seen that before. I know that, I oftentimes connect my patients to discuss the best plans to choose while working with you. And I know that you're able to identify scams in that way. I didn't realize that we ourselves could call a phone number and then kind of report a scam. I think that'd be really.
Yeah, I'm going to put it in the chat because I have to, my PowerPoint, it's just, I'm not real tech savvy, Nathan, and it takes me a minute to put stuff up.
Oh, no
So
rush.
I'm
Thank
just
you for
going to
your
throw
time.
the number in the chat. And they can also call us and we can get them that number. But it's the Senior Medicare Patrol. We used to be a grantee for it. And then the grant went away and I hear it's coming back, but we don't have it right now. Senior Medicaid Patrol, rather, for fraud and scams. You can also report to the Attorney General's office. And that number is 866
Got you,
642
Sherry.
4767. Okay, you got that?
Yeah.
Oh.
I also, if you all can see my screen,
Oh, good, thank you.
I have it up here too. I found it on the slides.
And if someone is not sure if something is a scam, they can also call us and we'll look into it for them.
Yeah, these scams are everywhere, almost weekly. I'm like, is this a scam? If it's coming through my email, my text,
Yep.
phone calls, voicemails, I'm fielding it for my own personal, and the vulnerability of our vulnerable seniors or aging people, it's a lot. So this is good
Yeah,
information. Thank you.
it's really a very, very serious problem. People have lost their life savings from that. So, and they get scared. So, we remind them, just if you think it's a scam,
Just
don't deal with it. And the longer you wait reporting it, the harder it is to resolve the issue. So if you think you got scammed, tell somebody, because we can often help.
That's great. Thank you. Well, if there
Thanks.
isn't any more questions.
Thanks for having me back again this year.
Yep, yep. Thank you for your expertise.
And
Good
feel free to
timing.
contact me if anybody has any questions, and have a good day, everybody.
Thank you. All right, since I have my screen sharing, I'm going to go ahead to our next. I wanted to give this opportunity just a few minutes. If anybody wants to kind of unmute. I don't see everybody, so I can't call. If you raise your hand, I don't actually see that on my screen. But if you want to take a shout out real quick and let us know if there's any upcoming programming events that your agency is expecting and you want to share that with us, or any changes, anything you'd like us all to know in the spirit of information sharing, go ahead now. All right, I'm hearing silence. Okay, well, if there is anything, go ahead and unmute and let us know. You can also put something in the chat if you'd like. Just wanted to give that opportunity in case something great is coming up for your agency. I will go ahead and move ahead with our Barrier Buster funding update. Probably the same as in June when we last met. We are still very, very limited on our funding. This is what it's looking like right now. So what we do, just as a reminder, this is what we allocate each month, first business day of the month. We allocate these funds to distribute, and it's also split with our housing. So for example, our 14.5 here from Washtenaw County, we're splitting that to $7,250 is going to go to flexible funding, and then that other $7,200 is going to go towards housing. So we kind of split between the two, and that's the same with township. So housing and flexible funds come out of that 12.5 and that 2,000. So that means that we're really only looking at like when your agencies put in requests, I really only have about 7,000 to 10,000 of funds that I can actually apply. So I am having to turn away a lot of requests, and then also because Ypsi Charter Township is only for the township residents, and Pittsfield is only for Pittsfield Township, township residents. And so that also kind of limits our availability across county. Across county is our general fund. So it's just a really small amount right now. So keep that in mind when you're putting in requests, and that there could be a potential for it being returned because we don't have the funds available. In August, we were out of funds by 10 o'clock in the morning. So you'll want to get your request in soon. Just to let you know, when I'm looking through and approving, I am looking for those that have match funds. And it can even be client matching funds, but I'm seeking those out. I'm looking for mothers with young children who are in active shutoff or have a shutoff status with, say, DTE. So I'm looking for those that are in the most critical state of the request, seniors who have no power, things like that. And unfortunately, it is requiring me to have to turn away a good number of requests just due to lack of funding. So keeping all that in mind, we do still have our SCIP funds available. You'll want to use that SCIP link. If you need more information on that, you can go to in June's presentation, we had some information from HBS on what to do. You can also, I think I posted on the listserv some of this HBS, Housing Bureau for Seniors, some of their information and criteria to access those funds. And then the Ann Arbor City Water, that's a rolling. So if you have a client that's in City of Ann Arbor and they have a water bill, go ahead and put a request in at any time of the month, because that's a rolling account that we can access and help support. And always our housing request eviction goes through the HAWK SOS pipeline. Any questions on my funding and the funding report? Okay. So just a couple updates for Barrier Buster programming. I have just recently sent out a new link for our portal. So if you didn't catch that in the email that I sent to the listserv, or the individual email that I sent out to all of our Barrier Buster users, reach out to me if you don't have that new link, because I will give it to you, because the other link is no longer. It has also been updated on the website, so you can find this link on the website. Also for portal users, just know that we've been in it now. We're in our 8th month. We started in January. And if you have not had activity in there in the last 3 months, you will need to ask to get that access again. And we'll just have to start over with the new access process. So you'll reach out to me if that becomes a need that you have. And then the last thing that I want to say is I am excited. I went ahead and scheduled us an in-person session for this meeting on November 19th at 1:30. It's going to be at the Learning Resource Center, the LRC, and it's like, what is that? I think it's considered Ypsilanti right there. Or is it Ann Arbor? I don't know, but I will have that address out for you all. So we will do a Zoom meeting from that location. So for those of you that prefer this method of joining the meeting, we'll still have Zoom available. But those that can make it in person, please do. I think that it's a great opportunity for us to kind of see each other in person and make those connections with our colleagues, and also, to network and ask questions that maybe doesn't seem as accessible here in this format. So mark your calendars. I sent out a save the date. I will continue to do that so we can all join if we can. I plan to have maybe some water and cookies available for us. So I hope to see many of you and see you all in person on November 19th. And that pretty much concludes my part. If anybody, again, an opportunity to shout out on any programming events that are coming up, now's a good time to shout it out.
Hi, Stacey. I guess I should plug Housing Bureau for Seniors Senior Living Week is coming up. That expo is October 11th and it's all free. And then the week after, and that expo is at Washtenaw Community College. And then the week after, throughout the county, our open houses, workshops, I'm sure most of you are aware, we do it every year, but that is coming up in October. So if you have clients that are interested in anything like that, and everything is completely free. So thanks.
Perfect. Thank you. That's what I'm talking about. Okay. Well, thank you everyone for joining us. And I'm going to stick around till everyone's gone in case someone wants to stop in for a quick question. I'm here. And as always, email me. You can email the Barrier Buster staff email, and that goes to both Kara and I. And we're here to help. So have a great rest of your day.
Thank you very much.
Yeah. Thank you, Nathan.